Evening, everyone. Welcome. We'll obviously just give it a couple of minutes to let everyone come in. Oh, I see. Bob's got is that a plant in the back, Bob? I thought we had an early Christmas tree for a moment. We'll get going in about a minute. We might appreciate people might still come in after that, but we'll start in a moment. Okay, we'll make a start. Other people may come in during the evening, but that's perfectly fine. I'll do some openings in just a moment, but a few things to let you know. We're going to post in the chat box code of conduct for the evening. We're happy for you to put questions in there. Depending on how many questions there are and how quickly they go, I may not be able to catch all of them, but we'll do the best we can to thread them into the discussion. So by all means, pop questions in. And if you want to have a chat amongst yourselves on the topics, that's great too. You have an automatic note taker, Martin. I think that's fine, unless hopefully Ross, Danny Ellis, is that okay with you? That's great. Thank you, Martin, for asking. As we talk through some of the subjects this evening, there might be some sensitive subjects for you. So as the intros are happening, we'll just pop a few items in the chat. One of them is the Health Assured partnership with the Lib Dems, where they offer support on pretty much any subject you can think of. They're a fantastic service. It's what the Lib Dems use for their employees, and they offer it to party members as well. So we'll drop that in there. And also a link to the Samaritans as well. Obviously a fantastic service. Neither of them are obviously crisis lines, but if you feel you want to chat with anyone about what we've discussed this evening, then you can use those services. We'll post them in a moment. So obviously mental health is a big subject for our party and our country. I'm going to proudly say that it was the Lib Dems during coalition government that opened the floodgates politically. Obviously campaigners have been looking at this for years, trying to get mental health on the agenda, but it was us in coalition that really put it on the political map, and now all political parties have policies. I even agree with the UKIP approach on child mental health. I mean, gosh, there's a thing to say, but everybody now talks about mental health. One of the big problems we find, though, especially in the media, is that mental health too often now is spoken about when things go wrong or when there's a tragedy. And it's right that we highlight these issues, and we may come across some of them this evening. However, we are going to try and challenge ourselves. On the closing, we're going to end on a kind of positive note. What can we look forward to in the future? So you've seen from the invite here, and thank you to Susie, Amy and Diver and the conference team who are doing fantastic events outside of conference like this evening. So thank you for putting this on. It's around looking at COVID-19, the pandemic, how that's affected mental health. So we'll be looking at things like service provision and stigma and different industries, sort of before the pandemic, what's the pandemic done? But ideally, we'll try and finish on a can we look forward to a better future in terms of mental health? Again, as we go through, drop some questions in the chat, and we'll sort of thread them in and ask them where we can. So we've got some great people with us tonight. We've got Ross Abbott, Danny Chambers and Ellis White. I'm going to let them introduce themselves, starting with Danny in a moment. Unfortunately, Ellis's camera is not working this evening, but Ellis, as you'll hear from her intro, is a fantastic addition to the panel. So Danny, over to you for a few minutes if you'd like to introduce yourself, and then just perhaps a short intro into what you think the current state of mental health is in the country.
Hi everyone, yes, so I'm Danny Chambers. So within the Lib Dems, my role is I'm the parliamentary candidate for Winchester, but outside of that I'm a vet, and I'm a trustee of a mental health charity for vets and vet nurses. And it might sound like a sort of niche subject, but it will probably surprise many people to learn that vets have got a suicide rate of about 4 times the national average. And so all of us have lost sort of fairly close friends to suicide within this profession, and it's quite a job that has a multifactorial sort of levels of stress, and that's something that we're trying to we'll talk about tonight, some of it. And another thing I do, I'm on the Council of the Royal College of Veterinary Surgeons, which is a bit like the GMC for vets, a regulatory body, and we're sort of using that organisation as a way of trying to support mental health within the veterinary profession as well. So how did the pandemic affect us, which is the point of this talk, the pandemic and mental health? Obviously it completely changed how everyone worked. And there are some roles that you simply can't do from home, and being a vet is one of them. You have to physically be treating animals, and there's also a job that requires 24-hour service as well. And so we had to massively change the way we work in order to continue delivering that service. So just for example, from a disease control point of view, we only saw urgent cases, which actually meant that there's a lot more sort of phone consultations, a lot of phone discussions, online discussions, video discussions to work out what cases actually had to come down, because we were obliged by the government to reduce unnecessary travel. So all routine things like neutering, vaccines were all sort of postponed, and only sick animals were brought in. And from a stress point of view, what surprised us, I think, is how many owners have a sense of entitlement that they're paying for a service and they want to be seen right now, and that the rules don't really apply to them, and that your sort of clinical judgment doesn't apply to them. If they want to bring their dog in, they want it seen, and they will get quite angry about that. So we found that we're dealing with a lot of sort of angrier people who are, I think in general, because of the pandemic, they're stressed as well, and they're worried about their health and their relatives' health, and sometimes you only need a sort of a reason to provide an outlet, and someone not seeing a dog if you think it's sick is one way of doing that. And of course, once the people got to the vets, we made them wait outside, and we take the animal in, treat it, take it back out, and that was just another sort of barrier to effective communication. People feel a bit angsty when they're waiting outside, they're not there seeing what you're doing, they have to trust you more, and it is another levels of anxiety caused for both vets and owners. But yeah, I think it's an interesting time sort of going forward now. Certainly something that affects us personally is that the pandemic was one pressure on our profession, but people probably don't realize that 50% of vets who register every year were EU nationals for the last few years, and 50% graduate from UK vet schools. And we've been short of vets for years, but since Brexit, there's been an 80% reduction in the number of vets registering to work in the UK from Europe. And added to that, over 3 million households in the UK got extra pets during lockdown. So there's a huge extra amount of work. And also now that we have to trade with the EU and we've got these trading barriers, the vets have to sign export certificates for all animal products going into the EU, which they didn't used to have to do. Everything, pizzas, cheeses, meats, that kind of thing. And so the number of export certificates that need to be issued has gone up by 350%. And so we're in a situation where there's a lot more work. We were very reliant on EU nationals, and obviously Brexit has added to the workforce challenge. And so our charity that has a helpline for vets and provide immediate referral if they need it privately has seen an increase by about 40 to 50% in the last 12 months. So stress levels and pressure levels and mental health challenges are certainly increasing at the moment. But yeah, we'll put this in context of general society. Obviously, I'm focusing much on vets in this introduction, but we will be talking about how this affects everyone sort of going forward.
First unmute issue of the evening. Well done, Lee. So thank you for that introduction, Danny. Lot to sort of pull out there as threads, and yeah, especially in the veterinary world, really interesting facts there that I'm sure not a lot of people are aware of because they're not in the field. So really useful overview. And yeah, we will pull some of the issues out. And of course, the B word, Brexit, always present around a lot of issues, and you've mentioned that. So thank you, Danny. Thank you for that. So Ellis, over to yourself. Unfortunately, as we said, Ellis's camera's not working, but Ellis, again, if you'd like to introduce yourself and give us an overview of what you think the current state of mental health is in light of the pandemic.
Hello, yes, thank you very much. So my name's Ellis, and I'm coming to you today wearing two hats, really. So I'm a business psychologist where I work to improve the relationship between people and their organisations. And mental health impacts your ability to learn, work productively, socialise, sleep, and all of these are integral to the life of an employee. So if you don't have an effective mental health strategy, a business will usually see things like higher sickness absences, higher turnover, more staff conflict, lower productivity and staff morale. And the work that I do helps support this to improve the mental health strategy. And then my other hat is that I'm currently completing a professional doctorate of education where I'm looking at the support that higher education students get when they're at university, when they experience poor mental health. Unfortunately, a student dies by suicide every 4 days on average at university in the UK. And I'm hoping to improve the knowledge, skills and awareness of the staff at higher education institutions, because at the moment, there's no research actually suggesting whether or not any of the recommendations as to what we can do to improve this, whether or not they're actually going to do any good. So I'm hoping to design a training course that is specifically for staff, because usually students will go to staff or a staff member will notice that there's something wrong. So I'm looking at perhaps doing a training intervention and measuring the student outcomes from that, and ultimately try and save lives. So to me, looking at mental health and the current state of it, I see in terms of the work I do as a business psychologist, I think that the pandemic has actually improved certain things, because a lot of businesses actually realised we need to do more, and it put mental health into the limelight a little bit more than it was previously. So there are certain things that I have actually seen improve over the last couple of years, but then of course there are things that of course need that extra support, and it's not actually looking as healthy. But then in terms of student mental health, that's something that I've seen deteriorate quite dramatically over the pandemic, for reasons that I'm sure you're already aware of. But the lack of social supports and the isolation, particularly at university, has been quite damaging. So yeah, it depends on what hat I'm wearing, depends on my answer for that, really.
Well, thanks, Ellis, for that introduction. A fantastic background. Good luck with your studies as well, but really great to have you on with the sort of those two different approaches. And again, there's quite a bit to pull out. I've noticed as well, we've got Claire Tyler. Baroness Tyler's our mental health spokesperson in the Lords. Fantastic work that Claire's done over many years. So thank you for being with us this evening, Claire. And Ross, over to yourself. And I can see there's an interesting banner in the background. So over to you.
Thank you very much. Firstly, I realise why Alice has got her camera off, is she's juggling these hats. So my name is Ross, and I'm a learning development specialist with an organisation, a UK training organisation called Green Cross Training. We provide many different hats as well, from hard hats to first aid hats, but also to mental health provision to organisations through business, through community groups across the UK, and actually since lockdown across the world. We're now across into 15 countries across the world, providing support, training in many forms, from what a lot of people might have heard of, for example, Mental Health First Aid England, through their training programs. We do suicide specific training through a Canadian company called Living Works. But we also do a lot of our own bespoke training, looking at business culture. And the reason why I say this is we had a pre-meeting on Thursday, and it came up with a point of where we're trying to do is to change culture, to change a way of thinking, is by starting to look at being preventative instead of reactionary. And I used a very analogy which Danny said he liked and was also mostly going to use at some point, so I'm going to get it in there before he does. Whereas anywhere in any workplace or any location, you would have a physical first aider to help somebody who has cut themselves, hurt themselves, out of breath, asthma, all those types of things. If a company is using heavy machinery, their safety measures isn't having a first aider. It's all the things that go before that. And what we're trying to do is to work with organisations, community groups and businesses to actually start to look at preventative measures to stop that slide down the continuum. And it starts with looking at stress. You know, stress is something that we all acknowledge. The health and safety executive acknowledge stress, and they are doing some really good things to start to manage stress, because long-term stress will lead to mental health and also physical illness, diabetes, respiratory problems, heart conditions, early menopause, immune deficiency, and a reduction in life. So we kind of looking at working with strategy through lockdown. I think for us, picking up what Ellis has said, you know, really focusing on business. Some businesses have got really, really good and they're picking up on this, but still 1 in 4 employees had no contact about their well-being during lockdown. And this is really when we should be raising our game, because what we're seeing a lot of is isolation. Routine has changed. Myself, I live with anxiety, and what manages my anxiety is a routine. And I think the 23rd of March 2020, my routine completely decimated, and it did for a lot of people as well. So with routine gone, that starts to look at the triggers which impact mental health. And that's kind of where we've seen kind of my focus is not actually in the end result of, unfortunately, a decline in someone's mental health, but focusing on those triggers. So for example, isolation. You know, isolation, there's studies that say long-term isolation has the same physical impact as smoking 15 cigarettes a day. People who are isolated for a long period of time are 30% higher risk of death. Financial implications from furlough, from redundancy, you know, and we're looking at kind of during last Christmas period, 61% increase in food parcels. So 6 families per minute interacting with some of the great charities that are there for food. You know, interaction with food and alcohol itself. Alcohol consumption went up 20%. But also looking at factors of being locked down with someone, domestic abuse, which I think personally is something that hasn't been talked about enough, an increase of 20%. So for me, what we've seen is an increase in vulnerability. Ronan Keane said, "Life's a bit like a roller coaster." That's the only line I can quote from it. But what this pandemic and the multiple lockdowns has done is really make people realise that actually even the most resilient of us can be vulnerable, and a lot of the time it's because of the triggers that are there because our routine has been impacted. Yeah, going back into the workplace as well, 46% of workers anxious about, as Danny said, about that return to the workplace. And for businesses, it's hard because it has been a bit like the okey cokey, isn't it? We've been in, we've been out, we've shaken it about a bit. And for businesses trying to set up their employees coming back into the workplace, that is hard for them to do. And a lot of it comes down to communication.
Great, thank you, Ross. Again, lots of things we can come back to on you there. And again, I've seen some questions in the chat, so thank you for that. I'm actually going to start. Claire, you've dropped a few questions in, and Ellis, so if I can come back to you first. You've dropped the statistics in there, what you spoke about, so thank you for that in the chat. But also picking up on Claire's question around what higher education institutions are doing, you know, in terms of support for mental health. And I think perhaps as a starter question then, there's been so much focus rightly on the students. There is an argument that the staff haven't got as much support. So there is kind of 2 channels to think about. What do you have to say on that?
Completely agree. And that is part of what I need to address, because you know, whoever you are, whether you've had the training or whether you're a psychologist or not, it does have an impact on you when you support people with poor mental health. And having done a previous study with the academics that are supporting student mental health and well-being, you know, there is unfortunately very blurred boundaries as to what their expectations are with their pastoral roles. And so that is the thing that I've seen pretty consistent throughout any type of university across the country. These you know, a lack of awareness as to what their pastoral role should be. And so you've got members of staff who are potentially and dangerously overstepping the boundaries because they just don't know at what point do they need to perhaps signpost and not get involved any further. And yeah, it is having an impact on their well-being. And the majority of the research that I've done myself, and you know, looking at the literature that's already been released, particularly by Student Minds, the UK's leading student mental health charity, their research mirrors exactly what I've been finding, is that they need more training and support to understand what their boundaries should be and how to effectively support, because unfortunately they haven't actually been given much direction so far.
Great, thank you for that.
Lee, is it okay if I add to that?
Yeah, Ross, go for it.
Yeah, and to say, you know, from our perspective, so we work with quite a few organisations that provide the student accommodation. And, you know, as Ellis is saying, this joined up approach, I think it's really, really important, because when it comes to matters that happen in a university against an external private halls of residence, there's often this information that isn't passed on because that's to do with the university and this is to do with the residents. And actually, you know, what you need to see is this more, and some of them have got some fantastic relationships with universities that they talk kind of what happens inside of university and actually, well, where they live outside of that. But there's also still a really big barrier between, well, actually, you know, this is university business and we've got our channels that we have to go down. And they're saying, but, you know, we need to be talking to each other because this is where they're spending a lot of their time outside of that. So I think there needs to be that joined up approach. And we see lots of and there's, you know, things coming out now about support to get members of staff trained to support students, even down at primary school. But, you know, I think there's a whole point of it's absolutely fine to have an obligation to support others, but that has to start with an obligation to themselves. And as Ellis said, you know, that impact that it has supporting someone else, I think we need to also be a focus of who's supporting the teachers.
Yeah, I completely agree with that. It's often overlooked. We focus so much on the younger people and the impact of their education, but we often overlook the people who are supporting them in the first place. And you know, there usually are things like EAPs in place, employee assistance programs in place for staff, but I still don't think that there is enough focus on the teachers or staff mental health.
Absolutely. Thank you.
Can I just pop in as well? Because I worked at universities quite a lot, at Edinburgh University and Bristol University for a few years, and I'm interested, not so Ellis thinks about this, is you know, you've got the pressures obviously from moving away from home and, you know, maybe adjusting to university life, but there's this sort of self-imposed pressure to be often a perfectionist, I think, or this anxiety that you're not achieving enough. And, you know, to give you examples, you know, we get, having been a tutor for a lot of students, you know, some of them are amazing people, amazingly talented, amazingly hardworking, you know, and certainly in the vet course, some of them might have, you know, 6 A's at A level, got grade 8 clarinet, and they will be crying on you because they only got a credit in an exam and not a distinction, when all you need is a pass, you know. and if you got that sort of it's been drilled into you that you need to achieve at such a high level that you view getting a credit as a failure and be something that's giving you sort of stress, it's going to be very difficult to then transition out into into a normal job, where with all the uncertainty that life and jobs throw at you, if you view a credit in an exam as a failure, and I do worry about this. You hear about kids doing GCSEs really stressed about exams and exam results, and it's causing a lot of problems going forward, I think.
Yeah, I could spend a whole evening on education. Maybe there's another session we could do there.
I think
absolutely
so.
agree. Thank you for that. I'm going to come back to you in a moment, Danny, because I've had a question from Woody in the chat. But just before I do, there's a really good point, I think, from Martin Cooper, who's mentioned, of course, that the Open University are a remote learning institution already. I got my degree with the OU. So really interestingly, they've been doing a dress rehearsal for decades, and then they've been carrying on delivering. So yeah, really interesting point. It isn't just the bricks and mortar, is it? There are remote learning opportunities as well. And online learning, I think, has kind of, along with streaming services and so on, have kind of really expanded during the pandemic. So an opportunity there as well. So good. Danny, I'll come back to you. We've got a sort of comment from Woody after you spoke earlier. Woody's mentioned that farmers and people in agriculture also have increased risk of suicide and other issues as well. Also mentioning COVID and our friend Brexit. So the question I put to you here is, do you think that the issues that were already present have been exacerbated due to the pandemic and Brexit, or do you think the pandemic in particular has brought new challenges? Thinking of your profession and your industry, do you think the pandemic has brought particular new issues to the situation?
When it comes to farming, I actually grew up on a farm. I'd say the pandemic itself possibly affected them less than most people. And the reason I'd say that, obviously you've got your general increase in anxiety and stress, and that we all living through a pandemic and worried about yourself and loved ones, dying, and the general disruption. But, it is the sort of job where you work outside anyway, often alone, often long hours, and often have limited interaction with other people. So your day-to-day job, if you, for example, milk 200 or 300 cows a day, didn't actually change that much during the pandemic because you had to have the same routine. I think for some people that's an advantage, isn't it? Because you can carry on doing what you're doing and didn't have to adjust to a different style of working. But certainly the reasons for stress and anxiety often boil down to things being completely out of your control. So, if you're farming, you can put in a huge amount of time and effort, huge amount of hours, and then different weather patterns or drought or flood can completely change whether all your lambs die one year or whether your crops fail or don't fail. An international disease outbreak, not just human ones, but foot and mouth, blue tongue disease, suddenly changes whether you can sell things, or BSE, like if everyone remembers mad cow disease, suddenly you can't export anything, completely out of your control. And then obviously these international trade deals, our products going to be undercut by other by other countries, completely out of your control. And I think what a lot of people probably don't recognize is how much stake there is in farming. So the profits might be quite low, but the investment and risk is high. So just as an example, if you're buying cattle and you might spend £100,000 buying a load of cattle to fatten up over the summer, and then you might sell them again for 115,000. So you're making 15,000 profit, which isn't a massive income. But something goes wrong, there's a lot at risk. So if it all goes well, your income is, low to average. If it goes badly, it is devastating. And that kind of pressure, I think, really adds to sort of stress levels. And and if you're also working alone without a friendship group, that's really tough.
Yeah, I'm going to come back to you as well on that, Ross, sort of linking in about the workplace as well, which you touched upon. Just a couple more things in the chat. Louise obviously mentioned quite rightly, people, we hope, are talking about it more openly these days. We're still nowhere where we need to be, are we? I mean, although we don't need to tell everybody all of our thoughts and so on, it's still more difficult for us to talk about our mental health generally. Whereas if you know, as bad as it is to say break a bone, eventually it can be quite funny when people sign your cast or whatever. It's still physical and mental still have that sort of divide. And we know, you know, without getting into the figures, NHS spending on mental health is way low below physical, and of that only a very tiny percentage is spent on young people's mental health in particular. And the P word, Ross, you've brought it up. Well done. You win the prize for getting in there first. Prevention. We say this all the time, and here we are still dealing with crises, aren't we? So yeah, big issues there. Claire, you've asked a question like, if we can get back to that at the end, we will. But if you're happy to confirm in the chat, you and Ellis, that I can connect you to offline via email, I'll happily do that. It sounds like you could work together well there. So Ross, going back to you, picking up on what you said about the workplace and also what Danny just spoke about. I've found, I mean, I work from home largely now. I have a sort of national job, but I don't have to trudge into the office all the time now. And I find lots of people are like, oh, everyone must get back into the office. And then somebody else will tell me, oh, no, everybody must stay at home because it's better or whatever. The issue is, isn't it, like mental health itself, it's a very personal thing. Do you tend to find that people think everyone should now go back or everyone should stay at home? What do you find?
What we're finding, and I'm kind of I'm taking a little bit of what we're taking out actually, is that businesses are taking on board and actually learning from some of these experiences. You know, ourselves, you know, as I said, from us, the ability to reach people and to communicate, you know, that has gone through the roof, you know. And we were talking about now how where Zoom before kind of was used as somewhere you just caught up with friends or did a virtual pub quiz. It's now been regarded more of a platform that you can use as a business, the same as Teams. You know, at times I feel they've been on so many different platforms. I think that thought that actually, you know, if you're not working from home, if you're working from home, you can't be productive. I think what we have proved over this period of time is that isn't true. People can be productive. I feel that, yeah, and there are certain organisations, certain businesses, certain tasks where they've been face-to-face all the way through. Some organisations have had a blend of people who are on site and people working remotely. And I'm starting to see that actually, you know, companies are starting, because we had this whole thing of actually no to work from home, and then it changed to, well, you can kind of go back. It is now up to the business to make the decision. That seemed to happen. It's all on you now. And businesses, what I found, weren't rushing back. They weren't rushing back into that situation. They were, you know, for a lot of them, they've put some good measures in place. They've talked to people that maybe are impacted by isolation, or in a house share with 8 other people that they're trying to hold a conference call. Everyone else that's furloughed is playing FIFA or Call of Duty. So, you know, for people who the situation, environment, which has a massive impact, wasn't okay, they were letting these people back into the workplace. And what we're starting to see is, you know, we talk about, and someone put in the comments about, well, what's normal? And that is, we could be here all night talking about what normal is. You know, workplaces pride themselves of employing individual people, because if you get individual people coming together as a collective, you can achieve some amazing things. And what I've seen has started to change to do that is this blanket management has changed, because if you've got individuals in your team, then you've got to manage them individually. And actually, you know, I've seen a lot of case by case of actually, you know, how are you feeling? And this is starting to open up another can of worms for HR professionals of actually changing contracts, because actually being working from home temporarily, as we were advised to do, and now people making a choice. But when it comes to health and safety, it becomes a place of work, not a temporary place of work. So that raises other issues like risk assessments, like DSE in assessments and all those things. But no, what we're seeing is actually people are learning from this experience, and if productivity is staying the same and the impacts are not there, then we're starting to see this hybrid, flexi, there's so many different words for it, actually occurring. My only concern is, through COVID, what we had in a lot of organisations, taking advantage of the furlough scheme for financially to keep organisations going, we saw more people take on work, kind of going back to the let's roll our sleeves up and we're all in this together mentality to get us through this period. What the work that we're doing, and I know the work that Ellis does as well with businesses, is we just need to be careful that this isn't sustainable. What we're going to get is burnout. And we sometimes get that in businesses, in saying, well, we've gone through the last 16 months with reduced staff and productivity is still the same. Let's just keep this going like this. It can't happen, because people will burn out. You know, there's been a change there's two different mentalities of we're all in this together to get through this period of time, and actually this being work. And I think that just needs to be realised with some companies.
Yeah, I think in my day job, I do a lot of sort of research around fatigue, and which of course leads to burnout in cases. And the one big thing I find, and this I think has been exacerbated by the pandemic, because we are now, you know, at home, I've got multiple devices. There's a bit of work here, there's a bit of personal there, but I'm still able to keep them separate. And it's something I'm very keen on. You know, when my laptop gets shut down for work, I'm not at work anymore, even though it's just over there. Whereas a lot of people are, oh, well, I just answered an email. You know, I missed a meeting the other week at 8 o'clock in the morning because whilst I was up, the invite was sent at 10:30 the night before. You know, the first question is, well, why were you sending emails at 10:30? So I think the ability, or the lack of ability, for people to feel they can switch off is a big problem. And also, you rightly mentioned, there were lots of people, you know, we all talk about our frontline health and care workers, but people in supermarkets, people in factories, you know, these people were working all the way through. So it's always good that we remember the working at home element still is only a portion of the workforce, like you rightly point out.
I think, sorry,
yeah,
just to quickly add to that, and I think this is something that has to be done as we move into this next stage, is that with businesses, I think we need to praise the role that everybody did. So for those that were feet on the ground, we have to praise those. Those that worked from home, we have to praise those. Those that worked from home and also had to homeschool, there's only so much that Joe Weeks can entertain a child for, need to praise those. But also those that were furloughed, we have to praise those, because everybody has had a part in their organisation of getting them, that organisation, to where it is now. And I think it's really important that we need to praise that, we need to acknowledge that, but then at some point there needs to be a line drawn in the sand and everyone moves forward again together. Because what we don't want to say as well, you know, 2 years ago you were furloughed for 6 months and I could see that your oil painting got really good. You know, for furlough, for some people were fantastic. Other people really, really struggled because they lost all routine, that social bonding, that having a chat over the coffee machine. So I think it's important that in every organisation, in every community, we really praise the role that everybody played.
We need to work together as a community, but individuals are important. Gosh, you're singing to a Liberal audience here, so that's fantastic.
Can I just come on that point?
Yeah, please,
really
Danny.
Brief one is that what you said is exactly right, and it really, one maybe advantage of the pandemic, just from people's perception, is that it showed that what everyone used to call like low skilled work, you know, was actually essential work. You know, and the people who couldn't work from home were people stocking supermarket shelves, or people working, you know, as cleaners in hospitals, and, you know, all the ones that wouldn't qualify, you know, for immigration status because they got too low a salary. Actually, we couldn't do without them to keep society running, and they're very, very valued, and they probably don't feel it. And then they're people with less of an income, less able to afford things like, you know, Ocado home delivery, that kind of thing, because they don't get those salaries, and higher risk of actually getting COVID. You know, so you're paid less, higher risk, and having to keep going to work while the world around you is struggling. And you know, and it's only certain types of jobs, mainly people with a much better education, who can work from home. You know, we're lucky if we can, actually.
And the sort of almost extreme other end, of course, then people in the nighttime economy, in the hospitality sector, couldn't go to work and couldn't. So that had the completely opposite, and they're still suffering now because, of course, a lot of people aren't quite sure to go back. Of course, note to all, of course, we're still in the pandemic, and
Yes.
Christmas is a bit wary. Do really consider your indoor settings if you're with people you don't know. But yeah, it's still going on, isn't it? I think some people, understandably, we're all tired of it now. I did have somebody the other day say to me, said, "Oh, this is terrible, the first pandemic since what was it, 1919 or 1920?" I said, "Well, I remember the one in 2002 and 2009, not quite to the same scale, admittedly, but yeah." So I'm going to oh, thank you, Claire, and good luck with your vote as well on the Armed Forces bill. You said good luck with that. Thank you for coming in, Claire, and I'll connect you with Ellis. So Ellis, I want to come back to you actually, putting your sort of business hat on this time. We had a comment from, I think it was David, talking about sort of neurodiverse people. You know, different people need different things in the workplace. And I think, is it not the case that what we talk about is the structures in place and the management needed and the training? Is it the case, do you think, we don't talk enough about, you know, how a workplace is actually laid out? I tire of open plan offices where everything's in a row. And do we need to look at how a business is physically organized as well for our mental health?
Oh, absolutely. You know, the world is not really set up for neurodiversity in the slightest. Even myself, you know, I've been diagnosed with different needs, and people have this automatic expectation that you are neurotypical, and they treat you so. And often when you might show some of your difficulties, it's not necessarily something that people automatically go, oh, okay, maybe they have different needs. Should I consider that? It's in case, oh no, they're unorganized, they're lazy, and they instantly go to, you know, considering that person more challenging. So I do think that there needs to be a distinct improvement of awareness. And also you'll find that a lot of adults aren't actually aware if they have their own neurodiversity needs, because it's not necessarily something that was you know, recognized. I didn't get recognized until I started my doctorate. So, you know, it took a long time, but it does need some more awareness. And because of that, it has you know, your workplace certainly has an influence. Things like your working day, for example, your hours that you work. Not everybody is a morning person, but most people are expected to start work by 8-9 o'clock. And you know, how your office is laid out, exactly what you were saying, you know, people not necessarily liking hot desking or an open plan office, or not having good access to light can even influence some people's mental health and well-being. And yeah, we kind of have these expectations that everyone can just sort of crack on and get on with it. But no, we need to focus on people as individuals, risk assess, have these policies in place that there are support available for people who might not necessarily fit into neurotypicalness.
Absolutely, thank you. And just sticking with you, Ellis, for a moment, obviously Danny and Ross do come in as well on yourself on this. In terms of, so the training, there's a few comments in the chat as well. And of course, Ross, you've rightly talked about training as well. Talk to us, if you can, Ellis, a bit about, I'm seeing a tussle in industry at the moment, different industries. And I think it's just the growing pains of, we're bringing all this stuff in, so we're figuring out what to do, where to apply. There are some companies that kind of give you a session on resilience and then go, well, you're resilient now, well done, tick the box. There's others who bring in things like mental health first aiders, but see them as a ceiling rather than a floor. What do you see? What do you see in sort of the world of business of, you know, when people bring in training, do they see that as the end of the process, or do you think they're open to doing more? And then I'll come on to you, Ross.
Yeah, I think Ross will definitely have something to say
Yes.
here, because we've had this discussion before where some businesses do treat it as a tick box exercise, that will have a variety of training on board, but don't necessarily take action with some of the skills that they have developed. And I agree with David's comment, does it end up burning out all the people who organize and manage that? Absolutely. But the training, firstly, if you have a reputable provider, hopefully that they can make it so that it is palatable for that particular person and the business. I always believe that bespoke training, or having a provider that's able to provide more bespoke skills, is more valuable, because sometimes you're sent to these trainings and you're having to mold it around your own services or your business, and it's difficult to do that if you haven't been if you're not sure of those skills. But sometimes, if you get the right effective training, it can help. But training is only one layer to that solution. You need to make sure that there are the effective policies and procedures and risk assessments that are in place that help to back that training up. And it's kind of a whole organization approach as well. It shouldn't just fall on one particular manager or one particular team of people. And that's one of the things that I find in mental health as well, is often I'll have conversations with health and safety teams or with HR, and it's only that team that has to that is kind of dealing with mental health strategy. And I'm like, no, it needs to come from everywhere within the organization. And that's what tends to lead to the burnout, because they've not got that support and the activity from the other areas of the business to help influence and take real action.
So Danny, I'll come to you again in a moment on your industry. Again, isolation and so on, affects training and so on. We'll come on to you. So Ross, can you train someone to be resilient?
We can raise awareness. We can start to make people self-aware, emotional literacy to start. But I completely agree with everything Alice says. My concern, and this can sound weird as a manager at a training organization, training is just one very small part of it. To say, as you said, and you say my favorite line, Lee, a tick box exercise. This is completely what we need to move away with. Picking up what people said about the community and about burnout, ourselves. So I'll be honest, about last Christmas time, I had empathy burnout. We'd run community free webinars to about 5,000 people, and I'll be honest, I'd had enough. So what is really important is that we look after ourselves. And it's sometimes great to say it to everyone else, but we're our worst enemies sometimes. But yeah, this whole tick box exercise, to do a little bit of resilience and say, well, 2 years down the line, when you're off long term with stress, but you had that half an hour resilience. It's training, as Alice said, is part of a tiered approach, and it has to start at the top. Not just in business, in lots of things. I'm seeing other comments coming in. It has to stop at the top, because if you haven't got buy-in at the top, how are the people at the bottom ever going to take this on board? Because it's about being honest, it's about being genuine. So it starts at the top, and some of the great work that Ellis does is going into organizations and actually, let's be open and honest and look at what are the problems. And for me, there's lots of talk about we should start to maybe, a bit like physical first aiders, it should be a legal requirement to have mental health first aiders. And people often say, well, is that a good thing? Is it or not? For me, the health and safety sector, they've come on a long way starting to talk about the health, safety and welfare of individuals, and they have come on a long way. Legalizing it, okay, I can see the benefits of that, but my concern then is it becomes a tick box exercise. That all of a sudden you have one or two mental health first aiders or someone who's done a bit of e-learning, and e-learning is absolutely beautiful in a balanced approach as a whole offering, that suddenly are now responsible for the whole well-being of an organization. They're not trained psychologists, they're not trained therapists, and actually if you don't, you're kind of putting your thumb into the hole at the bottom of the bucket. If you don't stop the water flow coming in, then it's, everyone's just going to get wet. And that's my concern, is this tick box exercise of, making it a legal requirement. And I do think that is the right move forward, but it has to come with a structure and a management system that allows that we look at the whole structure to do with the impacts, and not just, as I said before, shove people in the bottom that have done an hour's resilience 2 years ago, and all of a sudden now they're going to make sure that nobody's stressed in the workplace.
Absolutely. So back to yourself in just a moment, Danny, and then that's, can you believe it already, the end of the Q&A section. Obviously we're all going to have a sort of final say, but just before I come back to you, Danny, on that, a few issues around, Louise has said, does HR swoop in and say, all right, well, you've had the course, so sort of what's the problem? Obviously there are varying different, approaches from different HR people, but that can be a problem. Do people feel they need to speak? Can they speak up? Or were they going to be branded as a problem, as Ian says, and then they don't think they can ask for help? Unfortunately, we have to accept in some organisations and some line managers that's going to be true. It's awful to admit, but the more we talk about it and try and reduce the stigma will help. Indeed, in the NHS, I know there was quite a debate for a while. Indeed, there still is. At one point, if you were a nurse, for example, with your own mental health issues, you absolutely never said that to the patient. And of course, what they started to realise, that if they start to do that, there's a bit of empathy and a bit of relationship building, but it depends on the situation, doesn't it? You can't just do it all the time. So now just on the first aid, at work regulations, I remember when Norman Lamb was still an MP, as a group of MPs saying, well, we need to add it into the regs. But actually the legal advice that they had is that you could actually interpret the existing regs as requiring it already. But I still think you need that kind of the words in there, really. So Danny, finally for you on this sort of Q&A section, we talked about training and so on, but of course, you and your colleagues are isolated, you're often alone. How do you get training? How do you get development in terms of well-being and resilience? How do you get access to that?
I think just to touch on follow on from what you guys have just been saying, actually, is certainly we've got a very low retention rate at the moment in veterinary, and that's partly because of the systems people have to work in. And you've touched on this in the way that you talk about other businesses, and there's a lot of similarity in that if you've got a business model where you're actually understaffed, but you can kind of even inadvertently blackmail everyone into staying late for 2 hours every single day, because you haven't got enough staff and animals need treating, people do stay. And you don't mind occasionally when it's busy and unexpected things happen. But if your whole business is running by everyone always staying late every day, that is when people will get real burnout, compassion fatigue, and then have either breakdowns or quit. And I think one of the best ways to help address this, a bit like you're saying about bringing in a legal requirement, is to make the business case, to especially the big sort of corporations, that looking after your staff's mental health is the best thing you can do for the productivity of your team. Because if you don't look after their health, you will always be in a recruitment crisis, and you will always have more problems and complaints and other health issues as well. And the other big thing I think is really important is people who are leaders in teams, whether high management or even like people who work in a more local sort of management, people who are mentors, to practice what they preach. So if you're a fairly new graduate, or you're fairly new in a job, and your boss always stays late anyway, maybe they like doing it, but they always stay late and they come in at weekends, you're never going to leave on time if you're new and your boss is always staying late. And it sets a really bad expectation and an example. And what you sometimes find, is just a generalization, but you see it a lot. One reason that the boss is staying in late is because he has a load of issues himself or herself. At home, they don't want to be at home. They're drinking, they're using work as an escape or as to fill a gap in their life that they're really struggling with. And then that's inadvertently setting a precedent that everyone else has to expect to come in at weekends as well. And I think once the leaders start taking responsibility for not only their own mental health, but overtly demonstrating good practice and good self-care, that will make a huge difference.
Absolutely. Thank you, Danny. So Ross, I'm going to come to you in a moment. We're all going to have a couple of minutes, just under a couple of minutes to answer a question. I've misunderstood, sorry, something Louise said. I can see you're having a chat there, so thank you for the clarification. Ross, I can see you've put about return on investment of doing mental health interventions, which can include training. I remember one study a few years ago showed that the cost to the country of not treating mental health seriously within the health and care service is costing the country about as much as the entire NHS budget. So we could effectively save the budget over again.
Ross,
So,
you probably know the year, but I think it was 2017 was the first year that more people were officially signed off work for mental health issues and physical issues.
oh, okay. Big
Somewhere
pickup,
around
like you said, Ross, as well with the HSE and sort of, you know, their stress management does a load of factors, don't they? But yeah, they do a lot of, they've just released their statistics, actually. I'll have another look at those. So thank you everybody for coming this evening. Thank you again to Diver and the conference team for putting this event on. Do watch out for your emails. There's going to be more events to come. So finally, we've all got about a minute left. So I'm going to challenge you all, start with you, Ross. Can you tell us something positive that we can go away with, whether it was affected by the pandemic, mental health services, stigma? Tell us something positive in a minute that we can look forward to that's going to get better in regards to mental health.
Wow. Okay. So through the pandemic, as I said, I think people have realised that that everyone can be vulnerable. When we've done that, it's enabled us to start to realise that actually, if this is impacting me like this, how does it impact every other person? So therefore, I think what has grown is empathy, seeing the world through somebody else's eyes. Even for a minute can make a massive difference. People aren't after sympathy, and they certainly don't deserve judgment. A bit of empathy, walk a mile in their shoes.
Lovely, very good, thank you. Danny, what about yourself? Something positive either happening now or that we can look forward to?
I think one big change in attitude is people, especially people in caring professions, even healthcare, and that is that people have realised that you can't care for other people if you don't care for yourself, and I think teams have realised that as well. And certainly teams seem to be looking out for each other a lot more than they used to, which I think is really important. It's probably the biggest seismic shift in sort of culture that I've noticed, which I think is very positive going forward.
Good. And just before I give Ellis the final word, I think my particular takeaway is that maybe this generation's children will be much better with personal hygiene in the future, which means automatically public health will increase. Maybe will hand washing, you know, better sort of personal space. But certainly you all coming tonight and having conversations with your friends and colleagues is really important. So feedback in the chat there from Diver, thank you. So Ellis, finally, tell us something positive we can look forward to with mental health.
I do think that there's going to be a marked change in attitudes towards mental health as well. It's certainly a big topic of discussion. We see a lot more support services available for businesses and universities as well. We saw a huge increase in mental health first aid training uptake. And I just think that general awareness is going to increase, which hopefully means that early intervention is key. That will hopefully reduce the pressure on services and effectively have a healthier country.
Great, absolutely great point to end on. So thank you everybody again. There's the chat box for your feedback. Thank you to Ross, to Danny, to Ellis. Great to have you here. Thank you again to Diver and the conference team, and hopefully we'll see you all again soon, and enjoy the rest of your evening.
Thank you.
Thank you so much for having us.